Hello everyone, welcome to first ever lesson of rehab classes. This is my first lecture, so let's just hope for the best. Now what we're going to do here is every day we're going to cover a part of first aid every day. I want to do it every day. If I get a positive response from you guys, then I would of course we will be making it keep going. And today topic that I chose is nothing but antimicrobials. It is pharmacology of medicine. Why did I choose this topic today? Well, I guess I was reading this topic today and I felt like making video on it because I have always felt learning the names of pharma, the drugs, is so difficult. The pharmacology by itself is such a difficult course. I always find it complicated. I have always struggled with it. So the aim of this channel is nothing but making the medicine easy. Yes. So what we're gonna cover today is these four classes of drug just in front of you: the tetracycline, glycylcycline, chloramphenicol, and clindamycin. Now, what are these drugs? Which category do they come under? Is bacteriostatic, that prevent the bacterial growth. Okay, when we have the bacteriostatic, what is the other class of drug that come in your mind? The other class of drug is bactericidal, that kills the bacteria. Now over here, these four are bacteriostatic, not bactericidal. All of them, how do they work? They bind to ribosome, but some bind to 30S, some bind to 50S. If we watch, I want all of you to watch over here. The first two bind to the 30S, the last two bind to the 50S. Now I want to go to each. First of all, the tetracycline, how does it work? It prevents the attachment of amino acyl tRNA. Now over here I want all of you to make a note. There is a limited CNS penetration. In glycylcycline, it inhibits the synthesis by binding to 30S. So simple, the simplest thing. The chloramphenicol, it binds to the enzyme over here. An enzyme which is peptidyl transferase. Now at last is clindamycin. How does it work? It blocks the translocation. It blocks the peptide transfer by binding to the 50S. Now we are gonna look into each drug one by one. All of these four drugs. Now first we are gonna cover the mechanism and the clinical use. After that we will go into its adverse effect and MOR, mechanism of resistance. Now first drug, as I told you, the tetracycline. When I hear it, the 4 cycles come in my mind. That's what its image in my mind is. Okay, so for this we have to keep in mind that all of these suffixes are similar: cyclin, cyclin, and cyclin. Now the example of drugs are tetracycline, doxycycline, minocycline. Among these drugs, look at the doxycycline. It can be eliminated in the fecal. So, therefore, it can be given to renal failure patients. Now, one thing we have to be really careful about these drugs is these medicine cannot be given with milk. These medicine cannot be given with antacid, not with iron containing preparation. Why? Let us watch into it. Why not milk? Because it has calcium in it. Antacid, because it has calcium and magnesium in it. Why not iron containing preparation? Because it has iron in it. Now these three things, calcium, magnesium, and iron, are divalent cation. Therefore they're gonna inhibit the drug absorption in the gut. Make a note. Now let us peep into clinical uses. It is given to the patient who are having Borrelia burgdorferi, It is given who has M. pneumonia. It is also effective against rickettsia and chlamydia. When we hear about rickettsia, what is the first drug that come in our mind is chloramphenicol. We are going to discuss about that drug today. And the doxycycline is also effective against community acquired MRSA, community acquired MRS. Now the other drug we are going to cover about is glycylcyclin. What we have to remember about it, its suffix is also same, cyclin, and so the drug example is tetracyclin. What are its clinical uses? It is given to gram-positive, gram-negative, and anaerobes, given to multi-drug resistant organism. Examples are MRSA and BLE. Now, also given to those who have the infection that require deep tissue penetration. The other drug is chloramphenicol. What we have to remember is some rhyming. Hemopneumoniae, look at it. Hemopneumoniae for chloramphenicol. What does it represent is Haemophilus influenza, strep pneumoniae, and Neisseria gonorrhea. Under what category? Meningitis, inflammation of meninges. Now the other is rickettsial disease. It causes Rocky Mountain spotted fever by which microorganism? Rickettsia rickettsii. Chloramphenicol causes toxicity. That's why it has limited use. Now it is mostly used in developing countries. Why? Because it has low cost. Low cost, that's why. Now the other drug is clindamycin. What are its clinical use? Anaerobic infection. Examples are bacterioid species, Clostridium perfringens. In aspiration pneumonia, lung abscess, and oral infection. Look over here, everything is above the diaphragm. Above the diaphragm, related to respiration. Comparing it with metronidazole, which is below the diaphragm. Whereas anaerobic infection in clindamycin is above the diaphragm. The next clinical use is strep A group. Now let us cover their adverse effect. First, for tetracycline, it causes GI distress, discoloration of teeth, and growth is very important part of child is growth is child. So what does tetracycline do is it inhibits the bone growth in children, and its adverse effect is also photosensitivity. Mechanism of resistance, it decrease the uptake or increase the efflux out of the bacterial cell by plasmid encoded transport pump. Now the other tetracycline, you don't even have to bother. It's adverse effect. It's simple, nausea and vomiting. Other in chloramphenicol, one adverse effect is dose dependent. The other is dose independent. The dose dependent is anemia, and other is aplastic anemia for dose independent. And the third is it causes gray baby syndrome in premature infants. Why? Because they lack something. What is it? In lacks an enzyme which is liver UDP glucuronidase transferase. Now the mechanism of resistance for chloramphenicol is the plasmid encoded acetyltransferase inactivate the drug. The plasmid encoded acetyltransferase inactivate the drug. And the last, clindamycin, the most important adverse effect of it is pseudomembrane colitis by C. difficile, and the other two is fever and diarrhea. That's how we finished the lecture for today. Hope you had boring but good time with rehab classes. See you next. Don't forget to like and subscribe. Take care.